Hi everyone, my name's Laura Kerr. I'm the Senior Policy Advocacy Officer here at Results UK on child health, and I'm very pleased today to be presenting to you a short webinar on transition and graduation. What does this mean for global health and what does it matter in 2018? Some of you will have seen the materials already on the Results UK website, so hopefully this is just a bit of background information in terms of context to tell you a little bit more about what is transition, why it matters, what are the biggest challenges and risks ahead, and what are we here at Results UK calling for to change this this year. So I just thought I would get started today talking a little bit about global health in 2017. We're in everything we're going to be doing in global health, we need to ground it in a few of the big changes that have happened over the last couple of years. The first one, a lot of you will have heard of, it's Sustainable Development Goals, or Global Goals as they're most commonly known. Some of you might have seen online, and that set us a really big target to reach universal health coverage for all by 2030. So this is only these goals came into force at the end of 2015, but we've only 12 years to go until this point. And what universal health coverage is that everyone can access the essential health services they need without there being an impact of a financial barrier, which ultimately is what we want to see across all the work that we're doing here at Results UK. So we've got this big goal that we're trying to achieve. But in terms of what we're doing in terms of financing for health, there's a lot of money spent on global health. That's, as you'll see on the screen, 19.2 billion. And this is from external sources from organisations such as Gavi, the Vaccine Alliance, or the Global Fund to Fight AIDS, TB and Malaria, but also in terms of what the UK government spends on health, as well as a lot of other donors. And this is a massive amount of money, and it's having a real impact on the world. But what we see is there are a lot of competing priorities out there in the world in 2017, and whether it be conflict, whether it be a lot more different diseases we're finding out about. But we still have a lot to achieve, and the money that's been spent on health is kind of flatlining at the moment. In terms of another little bit of context, the majority of the world's poorest people now don't live in the poorest countries. We've seen a change since the year 2000, when there were 63 countries that were considered low income. So these are the countries that have the smallest amount of gross national income per person. But in 2016, there was only 31 countries. So the poorest countries we've actually seen halved, which is great. And we're seeing less people than ever before living in poverty. But ultimately, diseases of poverty and who they're affecting and where these people live aren't traditionally what we've always known. So that's changing, and that's why we're going to come on a little bit to why transition matters. As you'll see there, 76% of people now live in middle income countries, and what we see is financing for health typically changes when a country moves from being considered low income to middle income, when they're able, well, it's supposed to be assumed that they're able to afford to spend more money on essential health services, but we'll come on to why, unfortunately, that is not always the case in a case study coming up. And just to say there again, to reiterate, middle-income countries, they only account for only 20% of global health spending. And we know that's where 76% of people live. That's a bit of an unequal distribution of where we're spending money on health from a country and donor perspective, and that's something that concerns us, because there was actually a study brought out by the WHO at the end of last year around Universal Health Coverage Day, which shows us categorically that even if a country is middle income, doesn't mean that they are automatically spending more money on their health budget and to meet the kind of the social services and the needs of their population. So as we come on to why transition matters, just keep that at the back of your mind. Just to exemplify a middle income country, and apologies there if you can't see the end of that word, we're looking at Nigeria. And these two graphs we've picked because they really show that Nigeria, which is a middle income country, has a lot of resource wealth. It's facing transition from multiple donor from multiple donors at this time, but their health kind of indicators show us that they're not performing even nearly as well as some of the low-income countries. So the first graph you can see there looks at the under-5 mortality rate, which looks at the fact that Nigeria has a much higher rate of 108 compared to 76, which is the low-income average. And specifically, the graph underneath shows their immunisation rate. So a low-income country average immunisation rate with basic vaccines covers, say, 80% of the population. In Nigeria in 2015, this was 49, and we've actually seen some new data since then in 2016 that shows that only 33% of children in Nigeria receive even the first dose of their most basic vaccines. So they're missing out of a whole host of others. And that just illustrates just one of the vast inequalities in the health system in Nigeria, which is fractured. There's not enough health workers. There's not enough medicines getting to the people they need. There's not enough health centres. And ultimately, this is a country that is facing kind of withdrawal of support from donors at a time where there's some serious challenges in the health system. And for us, and I'm going to come on to our definition of transition next, is countries like Nigeria and the children who are missing out on vaccines. That's why transition matters to us, because it's the children who are going to be left behind, or the people who don't have access to basic health services already, never mind the situation the country might be in the next couple of years. So moving on to transition, which is what you're all here to learn about, and what the definition we use is to do with when gross national income grows, donor financing may stop, it may decline, or the nature of support may change. And it's very important that transition, we acknowledge that this is a process. It can be it can be seen as a certain point when, as we say, that donor support changes. And this a lot of the time happens when a country moves from being low income to middle income. So as you'll remember from the stats at the very start of this presentation, there are more middle income countries than ever before and less low income countries. So we know that more countries are facing this change in relationship and in terms of the support that they have. So some of you might have heard transition is a very technical word, and we would love to find something else that sounds less scary. But there are different ways of talking about this process. It can be a change in relationship, changing donor financing, donor withdrawal, changing aid relationships, are some of the terms you might have heard used by different stakeholders or by our Secretary of State to describe this process. But what you've got on the screen there is what we believe the changes, and what we should really highlight is that this is beyond financing. So a lot of support the donors give to countries is financial, but it's also about the technical support that comes alongside this and the partnership and what that brings into when countries are trying to tackle some of their health inequalities. So it's just important to remember it's not just about the money, but about the whole relationship, and as it changes, what impact that's going to have on health services. So just a couple of examples of countries that have recently transitioned because they've become middle income or for other specific reasons. We have Sri Lanka, Indonesia, Moldova and Honduras have all graduated in recent years with support from Gavi, the Vaccine Alliance. And a lot of countries are entering this transition process now because they've recently been reclassified from a low-income country to a middle-income country. And they're countries, as I've mentioned, Nigeria, but also countries such as Kenya. So what is the risks? And I've touched on a little bit of this before, but when a country transitions, kind of what happens? As we've said, they can lose access to funding. They won't receive the same amount of financial support, and this change can come either after a kind of a short time, a longer time. It might be a big reduction at the start of a year, or it might be kind of small reductions over the course of a number of years. This requires countries to be able to find resources from their own, for example, their own health budgets. We call them domestic resources. And they need to expand this to cover kind of whatever changes or what gaps could be left when donors aren't there anymore. I mentioned before, it's also about the technical assistance that donors can bring, whether it be staff time, the staff who are deployed into the Ministry of Health of other countries who can help them as they define their programmes or are dealing with transition. And this is often very, very commonly linked to financial support. And if a country is not given financial support, they might not be providing their staff time, their technical expertise to the country at the same time. And also the third one there is around civil society now being included. The big donors, when they're involved in countries, they're often they create a sense of partnership. They bring people together. They make sure that when decisions are made, there's often a full multi-stakeholder kind of group of people brought together, and that often includes civil society organisations. And we're really worried that when donors aren't there to bring civil society organisations to the table, that countries who don't see civil society organisations as favourably as we're lucky enough here in the UK, they could be excluded. And we see this specifically around vulnerable and marginalised groups. So, for example, with the work that we do on TB and the links with HIV, groups which are working with prisoners or men who have sex with men or sex workers who traditionally donors or governments would not want to fund support of, that donors have been providing support for essential services. When they're no longer there, these can be people that are completely then just excluded from decision-making processes, and they're also losing the funding that we've mentioned above, so that can really hamper services. And all of those things, what it matters to us is because the impact that it then has on services, as I said, for vulnerable groups, for the wider population, that if a country is unfortunately not in the position or has the capacity to either provide technically the programmes they need to, or have the financial support there in their own domestic resources to cover what was previously covered by donors, ultimately services won't be delivered and people won't. It's people who could access, who are not going to be able to access services such as kind of essential vaccines to prevent, extreme diarrhea or pneumonia. So we see children dying unnecessarily. So at the heart of everything we do, it always comes back to the people who are going to be affected when services can't be delivered. And just to highlight, there's a kind of a triple burden that happens during transition. As I said there, it's reduced support, it's increased costs, and it's the difficulties in expanding services. So on that, it's around what I've mentioned before, lack of financing and the technical support, which goes down. There's also the increasing cost, because when countries have donor support, for example, through Gavi, the Vaccine Alliance, or through the Global Fund, they're able to access drugs, medicines and vaccines at a much lower rate, much lower price, and they might not be able to access them once they have graduated from or transitioned away from support from those multilateral organisations. And what we're also seeing, and to bring it back to Nigeria again, is they have an immunisation rate of 33%, and they're working hard to address this, but they're having to address that at the same time as those three, reductions in support that they're getting and the increased costs, while at the same time already trying to deal with the fact that people are missing out on those essential services. So that's quite a lot for countries to deal with kind of all at once. And I'll just talk very briefly now around the types of transition that we're talking about. So we've got that it's a process. It can be bilateral, so that is specifically around UK government support from the Department for International Development to countries like Nigeria or Kenya or Ethiopia. And that's a kind of one-on-one relationship. And then we have organisations that I've mentioned before, Gavi, the Vaccine Alliance, the Global Fund to fight AIDS, TB and Malaria, and the Global Polio Eradication Initiative are just three of the big health multilateral organisations or partnerships that what donors do, such as the UK, Canada, the US, put their money into this funding mechanism or multilateral organisation, which then delivers kind of services or support to a number of different countries. So it's harder to track, for example, a UK contribution to Gavi, which countries those goes to, but they are big multilateral organisations which have had a massive impact on the world, saving millions of lives. But they're also going through a process of working out which countries they provide support to and what does the process look like as they withdraw from them. And one of the big things that we're really concerned at here at Results is about the simultaneous nature of both bilateral and multilateral transitions. So that's about when transitions, as the word simultaneous suggests, happens at the same time. So if a country is facing withdrawal from DFID, from Gavi and Global Fund at the same time, what does that actually mean for the burden that is put on the health budget, which might already be too small? There might be already fragile health systems. What does it mean when they all leave at the same time? And I'll talk a little bit more about that in just 2 seconds. And highlighted at the bottom there, all those organisations and bilateral across all the different government donors there are, all have different policies and different eligibility criteria. There's not a strict cut-off that's like when a country moves from low income to middle income, they automatically lose all their funding. But there are different positions of all those different organisations, which we'll come on to some of those challenges and what that brings about now. So transition challenges, we've got 4 big ones. We've got the timing and how long countries are given to be able to increase their health budget or create the political will to increase their health budget. Sometimes they're not given enough time to make the changes that they have to be able to ensure that programmes continue when donor support isn't there anymore. Some of you might have heard about a financial cliff, which is when donor support ends suddenly, and it's just, well, countries then have to just try and find the money from somewhere to make sure that services continue. It's back to the people who are affected, who are ultimately going to see services there one day and not there the next. We have around the kind of the process, so transparency and accountability, said lots of different processes, lots of different policies, lots of different people involved. It's really hard to work out what is going on and what is the exact change at what time and why is that decision made. So that can be quite hard for us as policy experts to even understand, and especially for the countries who are facing transition now. The third one is about a lack of and uncoordination. So donors can often be changing their policies around transition without even talking to another donor, which might also be going through the transition process at the same time. And that means that the true impact of what the changes are going to have can be really quite relatively unknown. We're calling on the fact that donors need to collaborate both at a global but also at a country level to make sure that if the health budget is not just going to be have lots of different demands from lots of different sectors all at the same time. There definitely needs to be a coordination from donors to make sure the burden that they're putting kind of on countries all at once isn't too much for them. And one of the big things, and why you might not have heard much about transition before, is about the lack of evidence. This is something that's kind of just happening now. It's quite a new concept, and we don't really know. There's not been a lot of evidence documented about what processes have went well, what countries have managed to take on ownership of their certain projects that had previously been funded by donors, and kind of then taken on by countries, and where are the examples of things that have gone badly and how do we learn from that? And we're really trying to encourage donors and a lot of these different processes to be kind of written down, and you'll see some case studies in some of the reports I'll mention at the end, which might be useful for you to have a read at. So we don't have a lot of evidence and there are a lot of different issues. So why does it matter to us here at Results? And I think very first it's about the fact that we know that there are such vast health inequalities in the world just now. There are still 1 in 10 children who don't have access to any vaccines at all, as just one example. And for us, at a time if we're really looking to what do we want to achieve, we want everyone to access the health services that they need. How are we going to get there at a time when financing is changing? But it also matters from a political and strategic point of view. Which is why now is the time we're asking you to take action on this. So politically, some of you eagle-eyed might have seen that our new Secretary of State, Penny Mordaunt, her first statement where she set out her 5 priorities for her time as Secretary of State highlights the importance of countries standing on their own 2 feet and the importance of UK government aid to be able to provide them with the support to do that. So this was her way of talking about transition without mentioning the word. But what she was really saying is, how do we move away from countries so that they are supporting the programmes that UK Aid has been supporting just now. So we know this is on her radar, and it's something she'll need to figure out. And we'll talk a little bit about DIF's lack of policy at the end of this presentation. We also know, if you look at Donald Trump and his statements, they're really looking at, where should USA ID be spending its money. This is something, again, they don't talk about from a transition point of view, but as we see donors thinking about which countries need our help the most, it's really important that they base those decisions not just on whether a country is low income, but also on a lot of the other health indicators that we care a lot about here, whether it be vaccination rates, undernutrition rates, access to TB treatment. And we should also say strategically from Results UK, we know that, and we work closely with Gavi, the Vaccine Alliance, and the Global Fund to Fight AIDS, TB and Malaria. Their boards are making important decisions about what their policies look like now and in the future. So we're really looking to why are those decisions being made, and what evidence do they need to make sure that they're not going to be leaving people behind, especially the vulnerable and marginalised groups that, especially with the Global Fund, has been providing support to. And I've just put some dominoes on there because ultimately it matters now, because a small change in whether it be for vaccination or for TB treatment can have a much wider impact on the whole health system. For example, if a health budget is put far more under pressure because a donor's withdrew, if that health budget is not growing, where does that extra money come from? Do you have to take it from another element of the health system to put it into another pot of money? So we really want to make sure that doesn't happen, and that countries are able to sustain the services that they're providing and tackle those inequalities that we still care about. To give just one specific example, because I realise a lot of what we've talked about has been quite normative, is a short case study on the Global Polio Eradication Initiative. So the GPEI is one of the biggest global health partnerships in the world, has been set up to eradicate polio, hence the name. And as we get even closer to eradicating this kind of horrible, paralysing disease, the partnership itself is closing down. So this is different than the other multilateral organisations, which I mentioned, because it's not to do with when countries transition, but it is the first of the main big partnerships even, who are going to see really big funding changes over the next couple of years. So they have an annual budget of around £1 billion that they're using to support countries, but this will decrease by about 50% between 2017 and 2019. 2019 being next year, so really soon. And this is kind of important because it could be one of the biggest global health challenges in the next couple of years, and we're doing our best to really highlight these changes are coming and we need to deal with them now. The most important thing about this partnership closing down is the money hasn't just been used to deliver essential polio vaccines. You'll see some of the key stats there that 70% of global disease surveillance funding comes from polio. That's 146 laboratories that could almost disappear if funding ends. It's 20% of the WHO budget. And we're also seeing in some countries, for example, as I said about the technical support, the WHO 50% of staff who work in those countries are being supported through polio money. So if polio money is no longer there, we're concerned about what happens to the community immunisation officer who is responsible for delivering routine immunisation and polio immunisation in some of the hardest to reach areas in Nigeria. There's no more money. Who's going to be there to deliver those services when polio funding ends? And it's that wider impact on the programmes, on the services, and then back to the unimmunised children and the people who can't access health services that this money has been vital in supporting up until now. So the potential impact of this is huge, and I would encourage you, for anyone who wants to learn a little bit more about that, to have a look at a report which I wrote at the end of last year that you'll find on the Results website, called A Balancing Act, Risks and Opportunities as Polio and its Funding Disappears. So just kind of coming to the end of the presentation, looking at best practice and what we want to see the UK do. So we've done a lot of thinking about this, and the three big things it comes down to is deciding when. It's about policies that aren't just focused on when a country moves from being low income to middle income. It must focus on more than that. It must look at the capacity of health systems going forward, the political will to for health and to increase health budgets, the coverage and equity currently of services. And it's about that expansion of services. There are vast inequalities. How do we deal with them? It's not just about maintaining a baseline. That's not good enough for us. And it's also deciding when bringing into consideration when multiple donors, as we talked about, simultaneous transition happens. How is that being accounted for? We also look at the process. We want there to be much earlier planning that are kind of country owned and costed, so that everyone knows as early as possible what the financial gap will be and what the programmatic gap will be, to ensure that there are plans put in place to make sure that the gaps aren't left. The need to make sure that countries have the correct technical capacity to do this, and a focus on sustainability from the start and about donors. And we don't argue for the fact that donors and aid should exist forever. But how do we make sure that the money that is being given to countries is helping develop country ownership, and also making sure that when donors aren't there, countries have the capacity and the will to still deliver those essential programmes. And it's about the communication, so that donors tell countries exactly when those changes are going to come into play, what the process looks like, so that these conversations are happening early, they're open and they're transparent about the changes that are coming. So the recommendations, which some of you might be familiar with from our previous monthly actions, is that for all those things I just mentioned about best practice, we want to see some of that actually put down in a framework or principles guidance document from the UK government, because at the moment we don't know how they're making decisions, whether it be from a bilateral point of view or the position that they have on the boards of multilaterals. So we really want to see them publish something that tells us why they think what they think, and what decisions they're going to make. What does the process of transition look like for them? We also want DFID to name a director level person responsible for managing the implementation of this document. It needs to be senior leadership, because it cuts across all of what DFID does, and especially in the changing relationships that we have with aid, with other government departments as well. And from a multilateral point of view, we're asking Gavi and the Global Fund to have fair policies on transition, which makes sure that after their support ends, that making sure that no one is left behind, and that we're still targeting the really vital important work of UK aid and the UK aid money that goes to these large multilaterals, really is tackling the health inequalities all over the world that still keep a lot of us here at Results UK up in the office at night. That is it from the presentation from me today. I'm very happy to answer questions, so you can always fire me an email at results. It's laura.care@results.org.uk. And for a much more comprehensive and succinct overview of this, Results has actually released a small 4-page document which you can get on our publications tab, which also has a really interesting case study in Nigeria for anyone who loves key facts and figures. It's called Leaving No One Behind, Considering the Impact of Donor Transition. The full team at Results in the office will be happy to ask you with any questions as well. But best of luck with all your actions, and we hope to see the UK government take on some of our recommendations this year. So thanks for listening.